Greetings, everyone, and thank you for joining us during this webinar brought to you by the Commission of the Churches on International Affairs of the World Council of Churches. The WCC has been advocating for the human rights of stateless people for more than 10 years ago. And we have organized several events on this issue, including webinars. You are following the webinar on the YouTube live stream, and we invite you to share your comments or questions in the chat room. I will collect them and share them with the moderator. This webinar will be moderated by CCIA Commissioner Reverend Professor Cornelia Füllkrug-Weitzel. She's a pastor and political science expert. For the last 21 years, she was president of Brot durch die Welt, the aid agency of the Protestant regional and free churches in Germany. Among other distinctions, in 2007, she was awarded the Federal Cross of Merit of the Federal Republic of Germany for her social engagement. Without further ado, I leave the floor to Reverend Cornelia.
Thank you so much, Sigma. I have the pleasure to be the moderator of this meeting, as Sigma already introduced. And I first of all want to welcome all of you, the people who are listening to us and following this webinar, and of course, especially those who are going to be our panelists. It's a great pleasure that they followed our invitation and that you follow our invitation, and that we will have this 1.5 hour now of the webinar dedicated to mainly 3 questions. Of course, the COVID-19 is a global pandemic, and it hits every country, and it hits every people, but it affects nation and people very unequally, relying on their pre-existing economic social status and their position in society, and it follows the already pre-existing inequalities and vulnerabilities and deepens them. The privileged remain to have privileges, access to income, food, social security, and so on, and health facilities. And those left behind are once more left behind in despair. So there's no wonder that those who are among those most marginalized and excluded people, which are stateless people and people in undocumented status or without any official status, that they would be those who would be easily even more overlooked in this very situation of the pandemic, when governments are unrolling their programs to protect people from the spread of the virus or to protect them from social or economic hardships following the lockdown measures they want to take in order to secure the economic and social future of their country and their people. The global nature of the pandemic, of course, obliged the governments worldwide to fight the virus together and everywhere, and to ensure that everyone has access to prevention measures, as well as to health facilities, as well as to vaccinations, as long as vaccines seem to be the only chance to get the virus under control and to prevent from mutations, so that this might become an endless story. Therefore, we will look into we will have 3 panels, and we will look into 3 aspects. First of all, we are very happy that the ground, so to speak, is set by an overall analysis of 2 of our experts, which I will soon introduce to you. Then secondly, we look at the different situation in 3 different regions, and see how people would be affected by potential or ongoing vaccination programs, which are about to be or are already unrolled by their governments. And thirdly, especially look into the question whether and what kind of responsibility and potentials churches and other religious bodies have or might have in order to facilitate access to health facilities and access to vaccination to all people, but especially to stateless people and other undocumented people like refugees and others. And this will be followed then by a general discussion. We planned in such way that we will have 3 panels with different panelists to whom I pose questions, and there will only after everyone from that very panel has been heard, there will be a chance for the auditorium to raise questions for clarification. That's not yet the time for discussing, that's only for clarification. Only after all the 3 panels are over, we will open up the discussion, the broader discussion, and like the panelists to react to your questions, which you could put into the chat and will be brought to my attention so that I will then repeat them and we will facilitate a general discussion. So first of all, this is a conversation divided in 3 different rounds. As I already mentioned, I'm very happy that we that we were successful in inviting 2 experts regarding the issue of statelessness. The first one will be Mrs. Marcella Roller. She's a legal officer in UNHCR statelessness section based in Geneva. In her role, she supports UNHCR's work to address statelessness globally, including through the Global Action Plan to End Statelessness and #BelongCampaign, I Belong campaign. Marcella previously worked with UNHCR in Lebanon and with UN Habitat in Iraq and Kenya. Welcome, Marcella. And then we have the privilege to talk to and listen to Mr. Amal de Chiquera. He's one of the co-founders and co-directors of the Institute of Statelessness and Inclusion. He has worked on issues related to the right to nationality and statelessness for over 12 years. He's particularly interested in the nexus between statelessness and discrimination and its implications on access to other rights. Amal is a Sri Lankan human rights lawyer defender. Welcome to you, Amal, as well. And we will immediately start with the first panel and start with questions to Mrs. Marcella Roller. As we just heard once again, intro, stateless, and oh no, we will first listen to watch a short video. Sorry.
Stateless people are people who do not have a nationality of any country. This prevents them from accessing fundamental rights and political, economic, cultural, and social rights that most people take for granted. Without nationality, they may not get an ID card, a passport, or any other proof of nationality. Doing day-to-day things can be a huge challenge for stateless people. Without nationality, they may not be able to travel to other countries, to see a doctor, to find a place to live, and even to get married. It may also be impossible to get an education, to work legally, to start a business, and to open a bank account. All of this prevents them from providing for themselves and their families and may force them into poverty and destitution. As they are unable to access certain rights, move freely, and work, many fall victim to abuses, exploitation, and human trafficking. The main cause of statelessness is discrimination based on race, religion, ethnicity, or gender. Many are stateless because they were stripped of or are denied a nationality because they belong to a certain group or population that is being discriminated. Statelessness is often passed down from generation to generation. Another cause of statelessness is when states disappear and new states and territories emerge. People in these new states may not get a nationality. Many stateless people have little to no support to change their situation. This makes them extremely vulnerable. Statelessness is not a small problem, but an invisible one. Today, there are believed to be millions of stateless people around the world. The only way they can escape this fate is if countries decide to grant them a nationality.
Marcella, as we have just heard once again in the intro, stateless and undocumented people in general and most refugees worldwide are already excluded from rights, from legal job opportunities, land property, any kind of social security and alike. What does this mean in times of COVID-19? How is their economic and social situation especially affected in these days by the pandemic and by the measures governments are taking in order to control the disease?
Thank you very much. So it's very interesting, as many of you will likely remember, is that in the beginning of this pandemic, virus was often described as being this great leveler, in the sense that everybody can contract the virus, of course, still the case. But soon it turned out that it wasn't so much the great leveler, because already marginalized groups were much more impacted directly by the health crisis, but also because of the mitigation measures. And these marginalized groups also absolutely include stateless populations. Stateless persons are more likely to have pre-existing conditions linked to reduced socioeconomic status, and to live in conditions that put them at heightened risk of infection. And yeah, like I said, they were more impacted by mitigation measures. And from the start of the pandemic, stateless persons have in various ways profoundly experienced the implications of their lack of nationality. So, of course, maybe most importantly, they were often barred from testing and treatment due to lack of legal status. Healthcare services were either denied to them entirely or were prohibitively expensive for those not legally resident on the territory, or they feared coming forward for testing or treatment because they were at risk of legal repercussions, such as detention. But your main question was about the socioeconomic impact, and that was also very much evident from the start. Stateless persons are more likely to work in informal sectors or be self-employed. And with the loss of livelihoods that resulted from the restrictions, many of them did not have access to social services, and so did not benefit from government aid packages in the countries where they were handed out. And is therefore expected that the pandemic has amplified already existing inequalities. So that's really the consequences on their socioeconomic status by the pandemic, but also their reduced socioeconomic status has put them at higher risk of contracting the virus. Many stateless persons already live in substandard housing, crowded housing, with inadequate sanitation that compounds the risk of serious outbreak. Because they often work in these informal sectors or are self-employed. They're more vulnerable to contracting the virus. And like I said, government relief aid packages are not extended to them in case they lose their employment. Another thing that I wanted to touch upon was the lack of information that many of the stateless persons are facing. Many of them live in remote areas, hard to reach locations. They face difficulties in obtaining information on transmission risks and mitigation measures. often information was not provided in a language they speak, or was transmitted through communication channels that they may not have access to. And finally, what we also saw is that mitigation measures and fear really fueled xenophobia and discrimination.
Marcella, I have to interrupt you here. I'm sorry, due to time. But I think I'm quite sure we will come back to that question. Let me just ask one more question. You mentioned safety umbrellas, or this life aid programs, relief packages. Are you aware of any government which made any specific effort to care for the inclusion of stateless people in such economic and other relief packages and social government services to assure that really no one is left behind?
So there was, yes, there were some exceptions. There were a few governments that have from the start that they really recognized we can only have an effective strategy to combat the virus and the spread by adopting inclusive policies. And that did not only include granting access to testing and treatment, but also extending benefits to stateless persons. So there are some exceptions, but this was rather the exception than the rule.
Thank you. We might come back later when we are discussing best practices. But thank you so much, Marcella. Now I want to ask Amal, of course, first of all, with regard to the social and economic situation, if you want to add something to what Marcella has been saying already, you are most welcome. Otherwise, no, maybe you start with that one, and then we have specific questions. Yeah.
Thank you, Cornelia. And I think, I would agree with everything that Marcella said, and also I think the video that we all watched, it helps to contextualize the issue very well. I think the point I would want to underscore, which relates to both the socio-economic impact, but also the health impact, is that in most cases, statelessness, as we heard, it's minorities and made state. And this means that there is often some kind of a policy imperative to exclude and to delegitimize certain communities. And it's in that context that we need to understand the structural challenges that stateless communities face in the context of the. And we see a tension here between, on the one hand, a public health imperative to protect all, because unless we're all protected, none of us are. But on the other hand, racist and discriminatory policies which are built on excluding some. So if historically you've been excluding and denying and delegitimizing some, how do you now, in the context of COVID-19, correct your flaws and correct your errors and start including all? And that's a very difficult step for governments to take.
And are you even aware of attempts of governments to use the pandemic as a tool to further exclude and discriminate and scapegoat and undocumented people, or of consequences of governmental lockdown policies for stateless people?
Yes, indeed. So this is both it's a combination of formal government policies, but also of kind of more populist political narratives and discourses. So, for example, in India, there's been, with the growing Islamophobia in India, there's been a ratcheting up of hate speech against Muslim minorities in India, which blames them for the spread of COVID-19. And this disproportionately impacts on stateless communities in India, be they the Rohingya refugees in India or members of the Muslim community in Assam who are now at increased risk of statelessness. So there is definitely a connection between the two. And we also see this in the context of mixed messaging between different government entities. So in Malaysia, for example, the Ministry of Health, very early on in the crisis, made a very positive step of announcing that regardless of your legal status, you would have access to free healthcare in the context of COVID-19. But that was then very quickly contradicted by the Ministry of Immigration, which started rounding up people who didn't have documentation and detaining them. And this shows that when there is a public health emergency, it is often the security and the immigration types of narratives which trump the health narratives, and that's to everyone's detriment.
Thank you. Of course, it is very difficult to estimate any figures and have any statistics, especially they are lacking with regard to stateless people. But it would nonetheless be interesting if you would know whether the number of people who are infected or who died of the virus is higher, specifically higher among stateless people than in the general population in that very country. Are you aware of such statistics?
I'm afraid there's no such information available. And that also goes to the point that stateless people are often excluded and not counted in various ways. And there aren't efforts to actually disaggregate statistics in this way as well.
Yeah, thank you.
So unfortunately, I don't have the answer to that question.
We know, of course, that once you get infected, you cannot, and if you get seriously infected, it hits you strongly. You cannot be cured by yourself and without medicine, but you need medical assistance, and in many cases, you need to attend the hospital. Were and are public health facilities open to all, respective of legal documentation globally, as far as you can see? Or were they conditional upon the provision of an ID card in the majority of countries?
So I think it's a bit of a mixed picture here. And I'm actually going to speak to the experience of us and our partners. One of the things that we did as a response to COVID-19 was to set up a COVID-19 emergency statelessness fund, which allowed us to work with community groups and grassroots activists and partners in a number of countries around the world. And the experiences of different partners has been very illuminating. So for example, in Bangladesh, we work very closely with the Urdu-speaking community in Bangladesh, who were historically stateless and who were formally granted citizenship a number of years ago, but they still face significant challenges with documentation and in terms of structural discrimination. And what we found is that members of this community have been denied access to hospitals for COVID treatment, but they've also been denied access to hospitals for other medical needs because there's a belief amongst the Bangladeshi population that this community is more likely to have COVID-19. So there's a story, for example, of a pregnant woman who was not given access to a hospital to give birth to her baby in this context. I think nice. Another challenge.
It would be nice to listen to more stories, but unfortunately we don't have that time. Maybe we come back to it later in the discussion. Excuse me, but we want to give justice to our other panelists as well. Thank you very much to the two of you, Marcella and Amal. There is a chance for a very quick round for questions of clarifications if there are ones. Here I'm relying on Segma, whether she found questions for clarification among the written comments of our audience. Segma?
Yes, can you hear me?
Yes.
So we have Nathan Day Wilson from the US, who is saying, as well as concerns around vaccine dissemination, I'm curious how panelists would respond to the debates about the ethical permissibility of vaccine mandates and immunity certification.
Okay, can we come back to that one, because that's not a question for clarification? Would you please raise that again at the end of the all the three panels?
Sure.
Are there any questions for clarification?
None so far.
So then we can go ahead. Thank you very much. Then we move on to the second panel. Our next panel will focus on two following questions. First is, we have reached the state of the pandemic where most governments are starting vaccination rollouts, or at least they are preparing for it, or they're about to prepare for it. It would be interesting to hear from our next three panelists from the different regions how these vaccination programs are planned within their respective region. Are the national vaccination plans inclusive of citizens and non-citizens? Are governments aware of the need to do so and to assure that no one is left behind, especially not refugees and stateless people? And if so, can this be made into an opportunity to address the whole issue of their total lack of rights? And second question, all over the world, there's reluctance among parts of the population to get vaccinated, included my own country, Germany. So it is well known that the pandemic will last as long as all people are immune against it, and vaccination being the most important measure to get there. How can churches help to change mentalities regarding vaccines and overcoming mistrust? These are the two questions which I asked all the three panelists to address. First, we have Mr. Gordon Simango. He is the director of the All Africa Conference of Churches, AACC, liaison office to the African Union and advocacy. He's based in Addis Ababa, Ethiopia. The office he heads is conduit of the AACC members' voices towards the AU. Its commission, the regional economic communities and the diplomatic community in Addis Ababa and beyond. Welcome, Gordon Simango. The second panelist will be Dr. Ronald Latan-Moya. He's a medical doctor currently working as the program coordinator for prophetic diaconia at the Christian Conference of Asia, CCA, based in Chiang Mai, Thailand. He belongs to the indigenous Mizo community of the northeastern part of India. Welcome, Dr. Ronald. And our third panelist is Mrs. Myra Naimi. She's the regional executive of the World Student Christian Federation, Middle East, working with youth of 20 student Christian movements in 7 Arabic countries. She's also the global program director of the Peace Building and Overcoming Violence. Myra is working on establishing international connections and strengthening WSCF-ME's online presence through social media and other platforms. Welcome, Myra. Gordon, as we know, most countries in Africa so far have no access to vaccines at all and not enough economic means to even dream about it for the time being. Yet others like South Africa already started. So in a way, that's a perfect moment to plan for inclusiveness of those programs yet to come. Is the African Union or are governments in Africa aware of the challenge to assure access to vaccines, even to those undocumented and illegal people and stateless people without misusing, and illegal people? And what are the reasons for skepticism with regard to vaccination, and what could churches do to overcome it? Or are they part of the discussion?
Thank you so much, moderator. So in my attempt to respond to the status of vaccines in Africa, I have just projected this map. I hope the ones in the background can project the map. It's just like my attempt to kind of like show a snapshot of how Africa looks like. So when you look at the map, you would find that there is, the main challenge is that of data and statistics. It's a huge problem, as the first panel has indicated. Not even data on statelessness, but also on refugees and also on targeting, but also on other people of concern. So on the map that you are looking at, I hope it's actually coming up there, you would find the gray areas. And the gray areas, basically, there is not much data that has come through. And this is the latest information that I got from the Africa CDC, Centers for Disease Control, African Union, and the WHO Regional Office for Africa. And this is dated 02 March 2021. So you would find that here you only have 19 countries where there is information. And the rest of the 54 countries, there is not really much information. You would also find that the vaccines that are now in Africa kind of like range. You have Sinopharm, Sputnik, AZ via the COVAX facility, Johnson & Johnson, Moderna, and you would also find that the targeting actually varies. So like from the healthcare workers, the elderly, the people in the security, and so on and so on. I also would like to say that in terms of Africa, I think in terms of perceptions as it regards to COVID-19 vaccine, a significant proportion across the continent expresses concerns around vaccine safety. And I think that's very important to mention, despite more positive perceptions on the importance of and efficacy of COVID-19 vaccine. And this ranges across, like if you talk to women, the perceptions are different. If you talk to men, the perceptions are different. If you talk to young people, the perceptions are different. I must also say that there has been lots of misinformation, which is basically inaccurate information, but not necessarily with bad intentions, but also a lot of disinformation, which is basically inaccurate information with intention maybe to deceive. And lots of this information is circulating on a daily basis on social media. The latest information, besides the one that I shared, which came on Friday last week, basically is to indicate that the Rwandan government has started vaccination extended to refugees. And on Friday, UNHCR reported that 416 refugees have been vaccinated. And this is one of the first countries in Africa to do so, which is very, very important. The same Friday, the Kenyan president, in his 14th presidential address on the corona pandemic, actually indicated that the rollout of the vaccination is going to start in Kenya. And the first phase is going to target frontline health workers, uniformed personnel and teachers. And the second phase would target elderly people and those with existing preconditions. And I must make it very clear that the vaccination is voluntary. So we talk of vaccination for all, but also we talk of access to vaccination for all. Those are two different things. And coming to the question where you're asking how can churches help to change mentalities regarding the vaccine? For me, I think churches or faith communities and faith leaders, I think they are in a very powerful position. They are our spiritual leaders, and quite a lot of people actually follow. They have a huge following in Africa. I think you build values, you build knowledge, you build attitudes, you even mold our souls and minds. So at the wink of an eye, you can build very strong foundations in advocacy for access to vaccine for stateless persons. But also at the wink of an eye, you can cause, I think, immense destruction if you're not careful with what comes out of our minds. I think we need to challenge ourselves and to challenge others and to act and speak responsibly. Because at the present moment, I think there's lots of misinformation and disinformation. And it's a pity that some of it is being propagated by faith leaders. So it's actually coming from the church in Africa. I think the populations listen quite a lot to faith leaders in terms of behavior change communication. And I think the churches can play a huge role in that. For me, what I have seen over the years is the churches have made a huge positive impact in behavior change communication when we look at other pandemics that Africa has wrestled with. We can talk of Ebola, we can talk of cholera, we can talk of malaria, we can talk of typhoid. I think this is a lot of wealth experience that the churches can ride from and step up as we are working on fighting COVID. And I think also for us as faith communities, I think my message is that let's also give space to science, data and evidence, and continue to be guided by scientific evidence too. Of course, our faiths and our interpretation of the scriptures are also very, very important. The churches in Africa, they have a huge asset in terms of they run hospitals, they run clinics, they train healthcare workers, they train nurses and doctors, lab technicians, you name them. They have mission hospitals, they have private hospitals. In fact, some of the best hospitals in Africa are run by the churches or faith communities in Africa. They also run schools and universities. And I think this is a huge asset that the churches in Africa must, or the churches worldwide must actually ride on. I think I can stop here, moderator, for my 4 minutes.
Thank you very much. That was exactly your time. Thanks. We will come back to the opportunities on the potential of churches to help facilitate access of stateless people and so on to health facilities later on. Thank you. That was a good starting. And now I come to Dr. Ronald Moya. In your region, several millions of stateless people are living in different states. Whole ethnic, religious, or national minority population groups have been purposely made stateless by the government. It has already been mentioned before, or forcefully expulsed without being accepted at their place of refuge only during the last years. I wonder how they would be involved in vaccination programs if they already exist, or in the process of planning. Can you tell us more about that?
Yeah, thank you very much, Cornelia. In terms of vaccine itself in the Asian region, we are actually a bit slow in uptaking the vaccine. South Asia is much more advanced. They have started in January, but in many of the Southeast Asian and the Northeast Asian countries, we are yet to even begin the vaccination. Some countries like Thailand have started in March, the beginning of this month, but many countries have yet to start vaccination. Yes, Asia has very large stateless refugee and migrant communities. And one of the, I think, what has already been discussed earlier in the previous panel also. But if we look at the Rohingyas, for example, in Bangladesh or Malaysia, there are commitments from the government to include them in the vaccination drive. The problem that we are facing in Asia, where even the vaccination has started, is the magnitude of people who needs to be vaccinated. That itself is a challenge. So many of the government are doing phase by phase rolling out of this vaccination. And even, for example, in India, it just started with those who are above 60 years old or those who are above 45 years old with comorbidities. So if it hasn't even reached the general population in general. So that itself is a challenge in terms of vaccinating such a large amount of people. But we see that there is a strong commitment, especially for the Rohingyas in Bangladesh or Malaysia, that the government said they will actually allocate 5% of the whole vaccine that they have received towards those who are stateless or those from the refugee community. Even in India, for the stateless people in Assam, they have the government have requested the state of Assam or the province of Assam to include them in this process. But as you know, that it's a state subject. Health is a state subject in India, so it depends on each of the state. So within the vulnerable communities, countries like Bangladesh are actually struggling with getting the vaccine for themselves, for the country itself. So most of these vaccines are imported, or most of these vaccines are not produced within the region. And even the ones that are produced within the region, there is a lot of skepticism because of the efficacy of the vaccine itself. So there are a lot of challenges in terms of people accepting to be vaccinated. And also what we have learned and what we have seen in the region is that because the first response to COVID was that they do a very, they had lockdowns, curfews, very strong measures. So they were able to contain the spread of the virus to some extent. So that actually causes skepticism towards the vaccine, and they're being very, very cautious of starting vaccination. So that itself is a little bit of a challenge. And as we see in the Asia region, the whole take-up of vaccination, of any kind of vaccination itself, is much lower than the rest of the world. So that itself causes a low uptake of vaccination, and also for countries or for nations to start vaccination drive. I think I will stop at that. Thank you.
Thank you very much. You wouldn't believe we have a very low uptaking of vaccinations ourselves as well, even in Germany. So, and having a much smaller population, but of course, with such huge population, the government has to make different ethical and moral discernments, I guess, which is not very easy. Thank you very much. And now we turn to Mrs. Mayra Naimi. First of all, it would be good to hear from you about the vaccination programs and vaccination plans, whether they are inclusive and especially inclusive with regard to stateless and other undocumented people. And it would be interesting to hear whether you recognize cases of specific discrimination in the vaccination programs in your region against this group of people, stateless people, refugees, IDPs, and the like.
Thank you. Thank you, moderator. Thank you, everyone. Well, I should be starting with highlighting that the first Arab countries to begin vaccinating their citizens and residents were the richest, being the UAE, Saudi Arabia, Qatar, Kuwait, Bahrain, Oman, and Israel. And as an example, the UAE stands out. It has almost 10 million, which has it has one of the highest GDPs per capita in the world, and also has one of the highest vaccination rates globally. And more than 2 million residents and citizens have already been vaccinated in the UAE, and even rich people from across the Middle East have been to the UAE to take their vaccine. So basically, the Gulf state has already vaccinated more people than the middle income countries, being Jordan or Lebanon or Palestine, and the poorest being Iraq, being Syria, with the ongoing war and poor across the country, across the nation. So for the non-Gulf Arab states being ridden with poverty, endemic corruption or conflict, the vaccination plans are complicated, not just by poor administration, but by a deep distrust for the political leadership. In Lebanon, we have to highlight that the vaccines, as per the Ministry of Health, will cover the country's residents, both Lebanese and non-Lebanese, also health workers and everyone. But the main problem is that people, refugees, undocumented, stateless, may refrain themselves from accessing health services just for the fear that their legal or medical the legal or medical status might put them at risk of detention or deportation, or they'd be more vulnerable. So these vulnerable groups often face the obstacles of accessing the COVID-19, even testing facilities, not just the vaccine, the testing facilities, and they are more likely to end up excluded from the vaccination process. So it's important to note that the exclusion of these groups may jeopardize the global effort to contain the outbreak, especially in these countries. And as we all know, Lebanon has been facing an ongoing political and financial crisis, and the whole region is emerging in problems. If we want to mention Palestine, Jordan, for example, like last week, the Minister of Health has resigned because of a problem in the oxygen machines, which resulted in killing 7 people. So the whole region is bursting in problems. As for the churches and the importance of their role, I just want to second what Gordon has already said in regards to Africa and the importance of churches there, having hospitals and schools and so on. It's the same case as the Middle East. So churches has to make some awareness, taking the lead, ensuring that people in their parishes are registered to take the vaccine. Because if we just let people do it by themselves, they won't do it because they just have bigger problems than COVID or the vaccines or so on. They just want people living under $2 per day. They just wouldn't care less about their health than eating and feeding their families. So, so the plan is that churches take the lead. They have to make some data sheets that they already have and engage people in registering. Well, I guess this is my time. Thank you, moderator.
Thank you very much, Myra. And as I said, it would be interesting to know, you were talking only about refugees and undocumented people, stateless people who themselves were not happy and did not show up for testing or for vaccination because they are fearing disadvantages, especially once their legal status becomes obvious. So, but my question is, is there any of the countries where you find cases of specific discrimination in the vaccination programs? So specific discrimination against stateless people, against refugees and IDPs?
Well, if I do want to start, it's about the people. The discrimination happened between between the people, between politicians having to take the vaccine and not elderly people or frontliners. So this is where it all starts. Sometimes it's really hard to pick up a certain example because of the amount of problems that the countries are facing. And if I want to take, for example, Syria, the situation in Syria is not sustainable at all. You'd go there, you'd have a meeting, no one is wearing a mask. So even the idea, let us begin with the COVID situation, the COVID status is not that recognized there. So this is why sometimes it's hard to tackle even the vaccine when the idea of a pandemic is not there.
Mm-hmm. Yeah, okay, thank you. Now I call on Segma because this is the time now for questions of clarification from our audience. Are there any?
So we don't have any new question or comments, but maybe they will be coming on later on. We still have the question earlier from Nathan Day Wilson about the vaccine dissemination, where he's asking, I'm curious how panelists would respond to the debate about ethical permissibility of vaccine mandates and immunity certification.
Okay, I think that's a good moment because Myra touched upon the issue already. Thank you. Who wants to speak to that?
I'm happy to maybe start on.
Yes, please go ahead, Marcella.
So, of course, this idea of having these immunity passports, having a system like that sounds very attractive in the sense that you can control the virus by opening up parts of the economy. But what I think is most important is that this type of system can lead, very obviously, it can lead to more exclusion, and perhaps not only temporarily, because I think such a system, you can only have that if everybody can get access to vaccines, and not just on paper, but also in reality, that they can overcome practical barriers, because otherwise it will lead to more exclusion. And what's also important to know is what is the scope of activities or areas that persons or services that people do not have access to. Is it showing up for work, going to school? Like, these are all very essential services or essential domains that everybody should be able to tend to. And because of restrictions, of course, temporarily that may not be the case. But if stateless persons, because they're not vaccinated, because they cannot get vaccinated, are are excluded from these, that's a big risk. And also what's a big risk of this is that this could lead to further discrimination if a certain part of the population is not vaccinated, and there keep on being these small outbreaks, then they can get further stigma and xenophobia towards them. So that's what I wanted to highlight in terms of this question. Thank you.
Somebody else who wants to answer to it, or?
I can add to that if
Yes,
that's
please,
okay.
Amal.
Yeah, I mean, I agree with everything that Marcela said, and I think it may be instructive to look at another parallel kind of phenomenon in the world, which is around digital identity, and that tends to be it on paper. It's a very attractive concept. The idea that if everyone's identity is digitized, that will enable them to access services and assert their rights more effectively. But what we are seeing with digital ID is that when digital ID systems are imposed on top of legal and policy frameworks which are discriminatory and which are designed to exclude, then all the digital ID is doing is actually further entrenching the exclusion of stateless people. And I think the idea of a vaccination passport, if it's not very carefully thought through, would have the same impact of further kind of entrenching the exclusions and the discriminations that stateless people face. So just a word of caution to development actors and public health actors that when responding to issues and when looking at how things can potentially improve our collective lives, it's often the minority, the extreme minority, who is not factored in because something which would benefit 95% of humanity may be seen as something that is inherently good. But if the impact on that 5% is so devastating that it just reinforces stigmas and cycles of exclusion, then it's something that we need to deeply look at. And I think something that the church as an institution needs to be leading the conversation on.
Yes. Thank you. Of course, it's good to make ourselves aware that, as Marcela once again did, and bringing us back to our first input, that the issue of equal access is much broader than just vaccination. That is for sure when it comes to the COVID-19 pandemic. Since we are, as I said, in the beginning or in the planning process of many governments for vaccination programs, and we are talking as churches about vaccination justice, and is a justice issue as well. We want to focus in our third panel on the responsibility and potential of the churches to help fight vaccination inequality. Of course, in general, but in our today's discussion, we'll especially focus on the exclusion and discrimination of stateless and other undocumented people. When I said in general, of course, we all know the intersectionality of discrimination. We know that maybe in some countries or some cultures, women are especially discriminated, certain ethnic groups are discriminated and so on, and that all comes on top of, or put it the other way around, in the COVID and the to be stateless comes on top of all that and deepens the discrimination and marginalization and exclusion. So, but as I said, for today and for our next panel, we want to have a special focus on the exclusion and discrimination of stateless and other documented people with regard to vaccination, and how the churches can help to overcome such discrimination and can fight the inequality. So I have the question I will bring to our three speakers from the region. It's the same question to all of you. How can churches advocate the right to life and to health of stateless people, and for their access, and can advocate for their access to health facilities and vaccines on the national as well as on the regional level? How can they facilitate the vaccination to undocumented and stateless people? Are there any best practices you are aware of? How do they assure that in their own health and social aid programs they leave no one behind? And what would be concrete recommendations for churches and regional ecumenical bodies to assure that there is vaccination accessible for all, including stateless people and other undocumented people living on the margins during the time of the pandemic? You need not to, each of you need not to address all the 4 questions, but just pick up 1 or 2 out of them, and then others may come in and fill in answers to the other questions. May I ask you again, Gordon, please?
Thank you, moderator. So I would speak more to vaccine justice and equity. And so I would really think that the faith communities need to be interested. They need to be involved, and they need to speak out. I think there's so much debate going on as it relates to vaccines, justice, and equity out there. For example, there's this discussion going on in intellectual property rights around vaccines and patenting, which is a big issue currently within the WTO. And I think it's very, very important for us as churches to kind of like, to get involved in such kind of discussions, because it's only through us advocating for vaccine supply shortages to be addressed in our countries, in third world countries and developing countries. So the map that I gave was only like 19 countries out of 54 member states where we actually have information. So we need to get involved, and we need to speak out. I think we need to call for accountability as well, as much as is possible. I think we need to take a wholesome approach to the whole health sector. Today we are talking about COVID-19, and I think some few years ago in Africa we were talking about Ebola, and we're still talking about Ebola maybe in countries like DRC now. And I think it's important for us to look at these health pandemics with a wholesome approach, where we're talking about the need to improve our health systems or health system strengthening in Africa. I would give an example that in 2001, for example, the African heads of states and governments, they declared in this Abuja declaration that they pledged to set a target of allocating at least 15% of their annual budget to the improvement of the health sector. And I think since 2001, if they had walked that path, or if we had been very strong in pushing them to walk that path, COVID-19 would have found us in a different place altogether in terms of trying to work on access to health. I think we need to move from communities on paper, or to advocate for states to move from commitments on paper to implementation on the ground. That's around vaccine justice and equity. I also really think that we as faith communities, where we do have an opportunity and a chance to influence from within, let's take those chances and at the same time influence from outside. So an example for us is that our General Secretary in the All Africa Conference of Churches this year was requested to be a member of the COVID-19 African Vaccine Delivery Alliance. We see it as an opportunity for us to influence from within, but also a chance to influence from outside. Of course, we would have to weigh our pros and cons, but where it is possible to be both within and outside, I think it's very important for us to advocate for vaccine justice in that way. I also really think that we need, as faith leaders, to stand up to address misleading theologies and scriptures that are being promoted during this time. I think it's how we talk about God and our interpretation of the signs of the times in this context. And I think this really have a huge impact in terms of vaccine justice and people being able to come forward and say, yes, we would like to be vaccinated as well. So really centering around this whole issue about on human dignity, which I think it's also very biblical, or it's also supported by many scriptures of different faiths. Having this wholesome approach, also not only looking at access to COVID-19 for stateless persons only, but also to begin to challenge systems that keep people statelessness. And so kind of like a whole holistic approach would be important. Thank you, moderator.
Thank you very much. In the first round of our discussion, you already mentioned that churches themselves hold a huge property with regard to hospitals and health infrastructures, which they could use as well. We might come back to that because it has been mentioned by Myra as well. How can the churches use their own properties and their own health facilities in order to help undocumented people who may not wish to show up as undocumented at any public testing or vaccination station, to still get their vaccination, maybe in churches or monasteries or wheresoever. I changed the order a bit and asked Myra before Ronald, if you allow.
Thank you again. Let me start. Conscience usually is informed by scripture as being the central requirement of loving one's neighbor, which is the core, one of the core doctrines of Christianity. And it supports the moral basis for churches mandating the COVID-19 vaccines. So churchgoers and church, as an institution, has a moral responsibility to protect one another from harm. What churches has to do is to set the example. Setting the example is through multiple things. First of all, because churches require now to be open for in-person services and the reception of sacraments. So this is why they should set the example. They should set it by opening the churches, by opening the mega churches, the mega monasteries, providing the facilities for vaccination. This is one. Second, as Gordon said also about scriptures, we should read scriptures in a biblical way, but shedding the light on what's going on now. We cannot take the scripture out of its historical concept and just put it on nowadays issues, being the vaccine and not taking it and so on. And as for the stateless people, most of the churches, they have data, they know about those people. So it's their duty to go to them. This is what church does. This is what we as Christians are commissioned to do. We should go to these vulnerable people. We cannot bring them in, but we should go to them. And this is the only way we can ensure that they are getting vaccinated and they are getting the attention they need, because the church is the only institution that knows exactly the state of the people, the physiological and the emotional state that currently no country knows it. Due to the common and in-person contact that people has in church communities.
Mm-hmm. Thank you very much for first of all pointing to the opportunities of churches to use their own spaces, but as well and especially to use their own knowledge and contacts with those people, knowledge about and contacts with people, with the most marginalized and excluded people who normally might not be even known to the official governmental officials, but are known to the churches. And I would like to add to other religious bodies as well. I think this goes true to all religious bodies from all the religions. People open up to their priests and their deacons and whatever, and so that they know physically the physical and emotional state of people. And as you said, it is important to go there rather than to ask them to show up which at in some places might be dangerous as well, because maybe they fear that there are policemen hanging around or governmental officials being present and, you know, kind of recognizing them and persecuting them afterwards. Yeah. And both of you, and both of you have been touching at the issue of influencing the narrative with from the biblical grounds, and shedding light on ongoing discussions and debates from an ethical point of view. Yes, sorry, Mara.
No worries. It's just because of the familiarity feeling that people has usually in church that they cannot find elsewhere, that the state does not provide. So this is the feeling that we should not try to target, but try to take it towards us in a positive way.
Mm-hmm. Thank you very much. Dr. Ronald, how do you see the opportunities, chances, and potentials and responsibility of the churches to support access of stateless and other undocumented people to health facilities, to testing facilities, and especially to vaccination?
Yeah, thank you, moderator. I think the example that we have regarding the testing is something that we need to take forward even for vaccination, because many church, their healthcare institutions, their hospitals, and the facilities were used in order for people to be tested, even though the state or the government was the one who was providing that. But they opened their spaces. I think that is one way that we can actually make use of our resources that is already existing in order for even for vaccination to be accessible for stateless, for refugees, for migrants, and the vulnerable communities in general. So we have seen those examples with regards to testing, and I think that we can do the similar kind of an initiative even for vaccination. And I think also, like, one of the biggest contribution that the churches have done during this COVID pandemic is the mental health perspective, or the mental health aspect of it. People have, the churches have been providing counseling support. They have been providing that mental health aspect. I think even this demystification of the worries or their concerns or misconception towards vaccination also can be clarified if the faith leaders or the churches have a clear, right, and correct information, and they disseminate that in their platforms. I think the trust that people have for faith leaders or church leaders would play a very important role in people accepting or understanding that vaccination is required for all. And also, I think that the churches have been, many of the churches have been journeying with the marginalized community, the people who are voiceless, the stateless people, the migrants, and the refugees. So being the voice for the voiceless is something that we can also incorporate in terms of vaccination equity. So we have been in solidarity with them. We have been journeying with them, and we can continue to do so, even in terms of vaccination access and also availability and also access for COVID-19 vaccination. And also being, I think the church also needs to be the one who is actually setting the example of getting vaccinated, because what we are seeing now is that a lot of people have worries or concerns regarding vaccination or any kind of this, even for treatment. So being an example and being the forefront in taking this and saying that, we see this kind of example from the Philippines or from Indonesia amongst the church leaders. I think those things can be something that the church can take forward. Thank you.
Thank you very much for reminding us to the advocacy part, which has already been mentioned by Gordon as well. Advocacy towards governments, to voice the concerns and the rights of the excluded and marginalized in this situation towards the governments and the regional organizations. Just to highlight once again what Gordon has been mentioning, using the opportunity, if invited, to participate in governmental official programs or multi-party programs in promoting the access to vaccination for everyone, and to ensure that the whole vaccination programs are totally inclusive of all people. Now that sounds very good. And I think it gives us quite some ideas. What would people, I shall not say people from outside, because you're not people from outside, but those whom we have invited as experts, what would be your expectations to churches and other religious bodies in facilitating vaccination equality and justice, and in facilitating very practically access to vaccination for stateless and undocumented people? Do you have any specific expectations, or do you see any specific as unique selling points of religious bodies, religious organizations in that very situation? Whoever wants to start.
Okay. Thank you. So I just want to expand on the role of churches and other religious entities in advocating towards government in order to make vaccination programs as inclusive as possible. And what I want to stress there is that when you read these vaccination plans, they may seem inclusive on the face of it, but and also because they do not really point out specific groups that cannot access it. But if you pay attention to certain practical barriers that stateless persons may experience, and that the government does not factor in, that also needs to, like churches also need to advocate to remove those barriers. And I can just mention a few of those barriers that are most likely. Of course, nationality or legal status can be used to exclude certain people from getting vaccines. But also lack of identity documentation can become a practical barrier. Often people need to show their identity document so in order to be vaccinated, and then also their vaccination can be registered. And the World Bank has estimated that more than 1.1 billion people in the world are unable to prove their identity. So it's very important that that programs are set up in such a way that these people can, in fact, access a vaccination. There can also be, in practice, inconsistent, let's say, admission practices in health clinics that exclude people. Like, even though everybody, according to the plan, can access it, if at a health clinic additional barriers are put up and certain people are excluded, that needs to be addressed. If vaccinations are too costly, that can really become prohibitive. But finally, what I would like to say is the lack of data on statelessness and on stateless person can become a big problem. Governments often do not know where stateless persons live. So if a government program is set up in such a way that people need to be invited for a vaccination, these people are very difficult to reach. So I would really like to urge churches and religious entities to pay attention to those details as well, and to advocate with governments to ensure that everybody can access vaccines. And what was already touched upon was also that churches need to advocate also towards their constituencies, that it is very important to get vaccinated, that it is a responsibility that they have towards the people around them. And yes, and that it's very good if they set the example by also getting vaccinated when they get the opportunity for it. Thank you.
Thank you very much. Amal, you want to add something? Sure, you have
Yes.
expectations.
Thank you, Cornelia. Yeah, I mean, to me, I mean, when I think about the role of church or any institutionalized religion, my mind goes back to, I guess, my experience growing up in Sri Lanka, which is a multi-ethnic, multi-religious country, and which has gone through deep ethno-religious disharmony. And the thought I keep on coming back to is that when the church or any other religious institution stands with and stands by marginalized communities, it's doing its job. But of course, our history, world history, is peppered with too many examples of all sorts of religious institutions doing the opposite. And in the context of statelessness, where the nature of statelessness is such that it tends to be people of particular ethnic or racial or religious groups who are made stateless or who are more vulnerable and at risk to being made stateless. I think there's a real role for all religious institutions to be playing to where it is the dominant religion in a particular country, using that platform to push back against discrimination faced by members of other religions, and where it's not the dominant religion to kind of stand in solidarity with and act in a way which supports members of its own religion, but also others, or people of no religion indeed. And I mean, just going back to the question of vaccines, so one of the things that I couldn't raise earlier on in my comments was that in the Dominican Republic, the state has indicated that it would provide vaccines to all Dominican citizens. And now this is a deeply problematic statement, particularly in the context that it is state practice which has resulted in the deprivation of nationality of those who have a very strong claim to Dominican citizenship. So state action to exclude, to deny citizenship, and then followed by state action to exclude on the basis of that denial. And the Dominican Republic is a country where the majority religion is Christianity. And so there is a question as to what the church can do in that kind of context. Or picking up on Marcela's point, in Montenegro, stateless Roma, those at risk of statelessness who belong to the Roma community, they are likely to be excluded from vaccination programs simply because they are not counted. So again, what can institutions do in that context? So I think there's a lot to be done to stand with and act in solidarity with stateless and other vulnerable communities. And this includes, I think, listening to directly and supporting communities directly. And while I would agree with Ronald about being a voice, I would push you to actually go further. It's not just about being a voice, but it's rather creating the space for communities to articulate their own voices, because it's not their inability to speak, but it's rather the world's lack of willingness to listen, which tends to be at the root of most problems. So I would say stand in solidarity, use your resources and your position in a way which prioritizes affected communities and ensure that that you can contribute towards shifting the narrative and shifting the discourse, and a situation in which people are not discriminated against, or where that discrimination is being addressed in some way.
Thank you, Amal. This has almost been a perfect summary of the different aspects which have been raised. Nonetheless, I think we brought together the many dimensions of churches' life and churches' opportunities to advocate towards governments and towards regional organizations as well, and to use their own resources, use their own property for standing in solidarity. And yes, Amal, I like the addition to say it's not just, I would say not just to raise the voice for those people, but the first priority would be to give space and make room for them and give the podium for them, the panel for them to raise their own voice. But where this is not possible or where they would not be heard, like in governmental discussions or governmental commissions, it is good to raise their voice. Both, I think, is important, but to start with letting people speak on their own behalf, of course. Yeah, it may be still that there are other best practices or there are other ideas our audience may have. We have like 40 participants listening to us, and I am quite sure they have their own experiences and knowledge and might be willing to share some of it. Is this the case, Sigma?
Actually, no more questions or comments so far coming from our participants. But maybe the panelists have questions for each other or comments for each other that they'd like to share.
As long as the audience wants to remain to be an audience and not to speak to us and to raise questions and comments, it may be we might have some time for you, our panelists, to speak to each other if you want to comment on something somebody else has been saying, or to add or to continue a certain idea which came up. You are most welcome to do so. I think it is it is a very difficult subject because we are talking about the multitude of discriminations and the multitude of uncertainties with regard to like data, which makes it a bit difficult, of course, to address the issue correctly. But as has been said, since religious bodies and churches especially are, all religious bodies, I guess, are rooted in their own society, normally deeply rooted in their own society, they have an advantage and a potential threat. The advantage is they could indeed access and go to the people who are stateless, who have no legal status, who are undocumented, and help them very practically to get access to vaccination, maybe through their own institutions, medical institutions, or by addressing hospitals or politicians or whomever, other aid workers, in order to remove barriers, very practical barriers, as we have been reminded. Sometimes it's very nitty-gritty work to remove very, very concrete barriers, or to advocate the government. At the same time, they might be party and they might be among those who are supporting discrimination of people of other religions or other ethnic background who are subject to being discriminated, expelled, made stateless. And in that context, it's extremely important that the churches start to look at themselves and confess their guilt and understand how they are part and party of the problem rather than of the solution, and start with narratives that are rather than building up even more hatred, de-escalating and embracing people and raising their dignity and the rights of all people who are created by God. So I think it is a not easy task, and it's not for the first time that we mentioned those different dimensions, because that goes true for all kind of discriminated people and group, and how the churches can be in solidarity with them and journey with them. But from other struggles, churches already gained a lot of experience how to stand by marginalized and discriminated people, And I think the whole webinar was meant to make you and make us even more aware and sensitive for this threat of additional discrimination and exclusion by the pandemic for stateless people. Here is one question coming up. There are some discussions around COVID passports in countries where vaccination campaigns are inclusive of all. Will these passports be considered as some sort of ID for stateless people, is the question. Who is able and feels free to react to that? Maybe Marcella or Amal?
So the question is whether vaccination passports can be considered as identity.
Some kind of ID.
So how I understand those documents is that they are supposed to accompany an actual national identity document, and that they are just to demonstrate, hey, this person can access this facility or can travel. So that is the sole purpose, and it doesn't come with the rights or that are associated with an actual nationality or statelessness status, because of course also rights are accompanied with statelessness status. So no, I do not see that that would be a solution that could provide an identity document. Perhaps Amal will add something.
No, that's true. But of course, we know that churches have a chance through their own documentation, for example, of baptized children. They normally can prove, they can help to prove the identity of people. But that goes true for helping to resolve the situation for stateless people in general and help them to get access to ID cards and to a recognition as a citizen. So there are some ways, but so maybe a vaccination passport would help, but I somehow doubt, but this is maybe a very German perspective. I doubt that you get a vaccination passport if you don't have an ID card. So, I mean, it all belongs to all. That's the problem. But yes, of course, the churches should look for, search for creative ways of supporting the vaccination. And I don't know in other countries. In my country, there are volunteers, medical volunteers, doctors, and others who used to deliver services to people who are not having any status and who are not eligible to access hospitals and access any medical facilities. And they, of course, they themselves, so the churches themselves can invite such doctors to give vaccines to undocumented people. They have to discuss with their governments to receive vaccines. That's the point. I don't know how accessible vaccines will be in all the countries, whether this is only an issue of money, whether you can afford it and buy it and everybody can buy it, or whether these are only governmental programs, which is the case so far in Germany. You cannot just go to any pharmaceutical place and say, I want to buy a vaccine. So it is only handed out by governmental officials so far. In this case, they need to, of course, discuss and push and challenge the governmental officials to hand out a huge number of vaccines, which will go undocumented for those people who don't have documents and will be served by the churches. But that's a very specific idea. Okay, I think we almost reached the end of our webinar. I hope it was helpful for those who are listening to us and for those who were discussing with us as well. Gave us some new ideas, and but finally gave us the push and the impulse and the motivation to work even more and harder for the total inclusion of stateless people in not only when it comes to the right to health, the right to life, but inclusion in citizenship, as well as total access to all the rights, and take this COVID pandemic just as one new impulse to do so, to struggle on their side. Thank you very much to all our panelists, and I wish you a nice, whatever it will be, night, rest of the day, or whatever. It is midday in Germany and snowing, and I hope the weather in your country is better, and you enjoy the rest of the day, and keep on struggling. La lucha continúa. Okay. All the best to you. Thank you very much for listening. Thank you very much for participating and sharing your wisdom and your informations. Thank you, SEGMA. Thank you, WCC, for organizing this webinar. I think it is important that we again and again get this kind of push. Thank you. Goodbye.
Thank you. Goodbye.
Thank you. Bye-bye.